Welcome to our first video on best practice, PICO, and its parts. It may seem obvious that before you can access, appraise, and apply the current best evidence, you need to find it. To find it, you have to ask a question. It's very easy to ask a question because we do it so regularly. Out of habit, we may tend to treat clinical questions similarly. I'm certain all of you know that there are significant differences between a colloquial question and a clinical one. There's a lot more on the line. As you'll see over the next few videos, you'll save yourself considerable time and improve your search for information by thinking through the structure of your clinical question. You may be thinking, this sounds great in theory, but I won't have time to ponder deeply about each and every problem when I have such a full schedule. Best practices don't actually ask this out of you. That's why globally tens of thousands of healthcare professionals practice evidence-based medicine every day. The evidence-based community developed a best practice for exactly this first step. Shocking, I know. It goes by the mnemonic PICO, which stands for patient or problem, intervention, comparison, and outcome. PICO. With the P, we ask ourselves, how would I describe a group of patients similar to mine, or what is the main problem? Some examples are elderly, child, obese, pregnant, etc. Let's look at a simple case. A patient comes in for your clinic to whiten her teeth. She wants to know, is it better to have a dentist do the whitening or buy an over-the-counter product at her local Duane Reade? So how would you describe this patient or patients similar to her? The P in this scenario would be an adult, because there's nothing, from this description at least, to really differentiate this patient from any other patient. Moving forward, the I in PICO is for intervention. Here you're asking, what is the main intervention you're considering? Staying with the same example, the patient mainly is considering in-office whitening or bleaching. The C stands for the comparison, the other treatment option. In some cases, there may not be a comparison. In this question, however, the alternate is an over-the-counter product or at-home bleaching, like Crest 3D whitening strips or Colgate whitening pen. The last part of PICO is the outcome. What are we trying to accomplish or improve? In this case, the outcome we're hoping to achieve is simply whiter teeth. In this last part, it's important to remember why your patient is seeking treatment. What's the outcome they came looking for? It can be easy to see this part of the question from your perspective and not from the patient's. So you need to take care to step outside yourself to think this through. Okay, so let's review. In this case of a woman coming into the clinic and asking whether she should use an in-office or at-home bleaching, we apply each part to develop a complete question, like the following. For an adult, will in-office bleaching, when compared to at-home bleaching, result in whiter teeth? Okay, try one for yourself. Let's go back to Aunt Karen from the home page. Under each PICO type in what you believe the problem, the intervention, the comparison, and the outcome are.